So I recently had someone reach out to me and ask if I could explain a particular type of disease called megaesophagus. And I'll be happy to. This is exactly why I have this channel. If you guys have any questions about any particular types of disease, please feel free to reach out and I'll be happy to make a video on it. Hey Big Handsome, you want to go for a walk? Oh, the nub says yes. Alright, let's go. So first things first, we need a really basic anatomy lesson. Swallowing isn't a passive thing. Think of the esophagus as one long muscular tube. Anytime we eat or drink, whenever we swallow, the esophagus uses very coordinated muscle contractions to push whatever we swallowed from the mouth down to the stomach. Food and drink doesn't just pass from the mouth to the stomach because of gravity. This is why we can eat laying down, or if you're really adventurous, you can eat standing on your head, and the food will still make it from the mouth to the stomach even though you're upside down. In the case of megaesophagus, for one reason or another, the esophagus loses all muscle tone, hence losing the ability to push food and drink from the mouth to the stomach. If a patient comes in for chronic regurgitation, not vomiting, but regurgitation, then megaesophagus pretty quickly goes on to the list of possible diagnoses. In true megaesophagus, it's actually pretty easily identifiable by chest x-rays because the esophagus has lost all of its muscle tone, and so it usually looks like some big fluid or air-filled bag just kind of sitting there in the chest. So if megaesophagus isn't immediately evident on chest x-rays, then we may do something called a barium contrast study. And what we do is we take this kind of thick liquid that contains something called barium and we get the patient to drink it. Now barium lights up really bright on an x-ray. If the patient has megaesophagus, it'll show up really well then. Another very common clinical sign that you may see with a patient with megaesophagus is going to be sometimes a wet chronic cough. And that's because megaesophagus predisposes that patient to aspiration pneumonia. And what that basically means is because they're regurgitating so much, they're at an increased risk of breathing some of that regurgitated material into their lungs. And I'm sure you can imagine this causes massive inflammation and pneumonia. So this is a very common secondary disease associated with megaesophagus. They might also have something like a chronically runny nose. I've actually seen people bring their pets in because they're worried that they might have some kind of upper respiratory infection or something like that because their nose is always runny. And it turns out that patient actually has megaesophagus, and what they're actually seeing coming out of the nose is regurgitated material. Once we've confirmed megaesophagus, then the next thing we need to do is try to figure out what caused it, because this is going to totally dictate the type of treatment that we choose. If it's a young puppy with megaesophagus, then chances are extremely high that this was something that they were born with. We call that congenital megaesophagus. And basically this means that they were born with some disorder either of the nerves associated with the muscles of the esophagus or some kind of disease of the muscle itself. If they're a little bit older, then we start looking for causes of acquired megaesophagus. There are a few different things that can cause acquired megaesophagus. Anywhere from certain toxicities such as lead or organophosphates, to certain infections like botulism or tetanus, to certain underlying diseases such as Addison's disease or one called myasthenia gravis. There can even be autoimmune causes, meaning that the body is actually attacking itself. There can also be other neurologic and muscle-related diseases that are a little bit more uncommon or rare. This means that if your pet has been diagnosed with megaesophagus, you need to prepare yourself for potentially a lot of expensive testing. But this is a very important step because if you can identify an underlying cause, then you can properly treat the disease. Otherwise, you may never get it treated appropriately. There are some instances in which you may get a diagnosis of idiopathic megaesophagus. Anytime you hear the word idiopathic, it means that there's no known cause. If we ultimately can't find the underlying cause of the megaesophagus, then the treatment is basically just care and maintenance, and it's a lifelong condition. The main goal of this lifelong supportive care and maintenance is to try and prevent the regurgitation as much as possible, as well as to try to prevent the occurrence of secondary aspiration pneumonia, which is going to be a lifelong risk for them. This basically becomes a lifestyle change, both for the owner and the pet. Because the esophagus is no longer able to make those muscular contractions that push the food and water from the mouth to the stomach, then you have to let gravity do the work instead. This means that when you feed a dog or a cat with megaesophagus, they have to eat in the most upright position that they can. One of the most common things that people use to accomplish this is something called a Bailey chair, and it basically looks like a high chair for a child. If you can train your pet to actually sit in one of these Bailey chairs while they eat, it basically sits them upright while they eat from an elevated bowl. And after they finish their meal, they need to stay in this upright position for a period of time to allow all of the material that they've swallowed to actually make it into the stomach. If you let them down too soon, it's just going to regurgitate right back out. The medications that we give to patients with megaesophagus usually do a few things. One is to reduce the chances of reflux from the stomach into the esophagus. So your veterinarian may prescribe your pet something like famotidine, which is Pepcid. Your veterinarian may also put them on something called a prokinetic. And basically what this does is increase the motility of the GI tract so that it makes sure that it's pushing all of the food where it needs to go rather than letting it reflux back into the esophagus. From there, different veterinarians may have slightly different treatments. Depending on the type of megaesophagus that your pet has, your veterinarian might actually start them on a medication called sildenafil. The trade name for sildenafil is Viagra. And since I want this channel to be appropriate for all age ranges, I'm going to leave all of those jokes alone. If an underlying disease that's causing the megaesophagus can be found and treated appropriately, then your pet's prognosis is actually pretty good. But if the underlying cause can't ultimately be found, and this is something that you're going to be dealing with for the life of your pet, then the prognosis becomes guarded. And that's because your pet is going to be at constant risk for developing aspiration pneumonia. Or if the underlying disease is something that can't ultimately be cured and is a progressive disease, then that disease may ultimately cause the death of your pet. And the number one weapon that you have for fighting this disease is patience, persistence, and consistency. In general, I advise owners not to go onto things like social media to try to find answers or treatments for their pet. This has a lot of potential pitfalls and can ultimately make it harder for us to help you get the best quality of life, because you can find a lot of conflicting information in the social media circles, as well as some really bad advice. But in some certain situations, social media can actually be a good thing. For instance, there are actually some pretty good Facebook groups out there dedicated to pets with megaesophagus. And while I thoroughly discourage people from going onto those Facebook groups and trying to give medical advice, because that can be ultimately dangerous and sometimes deadly, I do encourage them to go look onto those groups and maybe become a member, because while they need to stay away from the medical advice, there's sometimes a lot of good quality care advice that people have come up with that works really well for their pet. And I'll be the first person to admit, even though I'm a doctor, I don't have all of the answers. And if somebody on one of those Facebook groups has a really good way of building a Bailey chair or has some good advice on how they can manage their pet, I think that's a really good resource. You just have to be extremely careful to not take medical advice from people in these social circles. Because if you decide to adjust the medications that your veterinarian has prescribed you just because somebody on your Facebook group says that something works better for them, then you're ultimately going to do more harm than good. Now, there's nothing wrong with talking to your veterinarian about a particular medication or treatment plan that you may have seen on one of these groups. This has actually happened to me several times, and I'm more than happy to look into those treatment plans or medications if I've personally never heard of them. But I definitely caution you not to take matters into your own hands on the medical side without consulting with your veterinarian first. I've personally seen some terrible outcomes whenever people do this. So that's megaesophagus in a nutshell. If you're personally dealing with this problem, or you know somebody who's personally dealing with this problem, and you have some tips or tricks that work really well for you as far as your care and maintenance at home, please feel free to drop them in the comments below. I'm sure other people who are dealing with this might benefit from that. Just please don't post anything about medication dosages or anything like that. And if you would like me to discuss any other diseases or conditions, please feel free to drop those in the comments below as well. I'll be happy to look into making videos for them. Anyway, take care, and we'll see you in the next video.